Welcome to the EAU podcast series, Women in Urology, Dare to Thrive. On this sixth episode, The Mentor Perspective, Welcoming Diversity, we are joined by Professor Bhaskar Somani and Dr. Jo Semins. Together, they will discuss how mentorship and advocacy can help foster diversity and inclusion in urology, exploring what makes mentorship successful from both mentor and mentee perspectives. Join us as we embark on this informative journey.
Thank you so much to the EAU for asking us to do this podcast on the theme of Dare to Drive Women in Urology, the mentor perspective and welcoming diversity. I've got with me Jo Semins, Jo Semins, who has got a medical degree from University of Pittsburgh and has been a urologist for the last 20 years. She's currently in Wheeling and affiliated with the WVU Health Wheeling Hospital. Welcome to this episode, Jo. We are really looking forward to the discussion with you.
Thank you so much, Bhaskar. It's a pleasure to be here.
Thank you, Jo. So if I can begin, Jo, when you reflect on your journey in endourology, what role did mentorship play in shaping your career?
It's a great question, Bhaskar, because mentorship was truly critical in shaping my career. I had a variety of mentors across different stages of my career, from medical school to residency and fellowship to junior faculty, and really even beyond. And they all helped me to navigate a successful pathway. Not only did they serve as role models to model my career, but they were also approachable and accessible to answer questions that would have been challenging to ask in other settings. They also served as fantastic allies, really catapulting my career by nominating me for numerous opportunities, all of which led to the next opportunity. And I've been very fortunate to have mentors that supported me and gave me a voice. And in turn, as my mentors helped to shape me as a mentor, I now try to do the same thing for my mentees. I try to be available to them, sometimes lending an ear, sometimes guiding them, and sometimes supporting and promoting them with their next opportunity. Bhaskar, a question for you. What were pivotal moments where mentorship as a mentor made the biggest difference in your life and career?
Yeah, for me, the most pivotal moments have been when I have seen a mentee take the next big step, whether that's presenting the first abstract, leading a project, or securing a fellowship or consultant post. Those are moments when mentorship truly pays off. And it's not just about giving advice, it's about empowering them to believe in themselves. I've also learned that mentorship is a two-way process. I grow just as much as my mentees do, and I learn as much as they do from me. The curiosity, enthusiasm, and the fresh ideas really keep me motivated and grounded. The best example of this is my colleague Amelia Pietropaolo, who came to Italy as a fellow 8 years ago and now has transcended as my endourology consultant colleague and a truly international KOL. So, Jo, what qualities do you think make an effective mentor in today's urology landscape?
So I really think there's 4 critical qualities. Number 1, which might seem obvious, but we're really yes people. And so sometimes I think we don't think about this, but is availability. So willingness to actually invest the time to coaching. Number 2, strong communication and leadership skills, being able to provide support and actionable feedback, creating a safe space to ask difficult questions while being compassionate. Number 3, emotional intelligence, willingness to help with personal development and challenges, navigating difficult situations, teaching work-life balance. And lastly, number 4 is advocacy, willingness to actually help them with their career development, creating opportunities for mentees, helping to promote them.
So, Jo, that's great. How do you balance guiding a mentee while allowing them to grow independently?
That's a great question, Bhaskar. So I try to offer my opinions and thoughts, and I share personal experiences and outcomes, but I typically don't intervene. So I give them the toolkit, I orient them to their utilities, but I allow them to use the tools themselves. And then I always circle back and discuss the outcomes with them.
Yep. I get that. And as a female mentor-mentee, this might be a difficult question, but do you encounter differences in culture or perception within the field of urology? And how did you navigate those experiences?
Yes, this is a difficult yet an easy question as well. So the short answer to this question is absolutely yes. The differences are really too many to even mention them all. And the differences occur on multiple levels. So both the patient experience and also the professional experience. So that's the short answer. The long answer is I can give with just a few examples, and I really can't mention them all. And some of them may be surprising to people. So the first one I'll mention is one of the most common experiences that I think as a female physician, all of us have experiences. And that's when patients and even staff assume that we're a nurse, even after fully consenting patients for surgery. Similarly, sometimes I'm at conferences and it's often assumed that I'm the medical device rep, not a urologist. Another example, and this was fairly shocking to me, several years ago at a former job, I found out that scheduling staff were informing patients that I was a woman and asking them if it was okay before scheduling with them. Another experience I can share is that I overheard two colleagues complaining about a resident who announced pregnancy right after she returned from her research year and criticized her, saying that she really should have planned better. So all of these are things that we're dealing with. But the last thing I'll mention, it's more factually to me, but maybe not specific examples, but it's always been a challenge for me personally in my career, is navigating the fact that women doctors are perceived differently when giving directives due to deep-rooted gender norms, expectations, and biases. Women are often perceived as bossy, abrasive, difficult, or emotional when being assertive, versus men who are perceived as clear, decisive, and have more of a natural authority. And I think women oftentimes feel the pressure to soften their delivery with more polite language, extra gratitude, can you please do this? Tone and attitude are really often judged. I navigate these experiences really one by one. I try to speak to mentors and female colleagues to see if they've had similar experiences. And the answer is always yes. And I didn't initially do this. I sort of hid these experiences, thinking that it was only me. But when I developed a network of people, that's when I realized this is sort of universal across the board. And I collect guidance from them, and it helps me to navigate them. And I try to pass that on to my mentees as well.
Wow. I'm sorry that it still exists, Jo, and this is really an eye-opener. And I'm sure we need to do something beyond just this podcast about this. Can I also ask how these experiences then shaped your own mentoring style, particularly in guiding female or underrepresented mentees?
Great question. So similar to my mentors, I've learned to listen to mentees as they share similar experiences and seek advice. I try to guide them based on what I've learned and also share my personal experience with them as well sometimes, so they understand they're not alone, as I once felt, and that they have a support system. And I try to teach them self-advocacy and try to help connect them with people with similar experiences to just increase additional support networks for them as well.
Mm-hmm.
So, Bhaskar, let me ask you, why do you think diversity in urology is so important, not only for our profession, but also for patients?
So, diversity is essential. It brings balance, probably perspective and innovation as well in some ways. In urology, our patients are incredibly diverse, and so should our workforce, because that reflects that. When patients see somebody who understands and shares aspects of their background, it fosters trust. Professionally, I think diversity encourages creative thinking and challenges the status quo, which we, as you just mentioned, are sometimes used to. And I personally think that teams with varied experiences and viewpoints are just simply stronger and more compassionate. And I'll give an example. In our endourology stone team in Southampton, we're so proud to have a truly diverse team with members from 7 different nationality backgrounds, all working and living in the UK. But this diversity enriches our perspectives, strengths, collaboration, and reflects a truly nature of modern endourology. So, coming back to you, Jo, in your experience as a mentor, how do you actively create space for diversity? Whether that's gender, culture, or different career pathways, what do you do?
Well, Bhaskar, I'd say that I'm intentional about who I mentor and how I support them. I really focus on listening. It comes back to listening and tailoring my mentorship to each individual's goals and contexts. I share my personal experiences, but at the same time, I try to not assume what worked for me will work for them. And so I also think that as a mentor, you should be an ally, as mentioned before. I think sponsoring your mentor should be putting their name out there for potential opportunities. And that itself creates space for diversity in the field. Bhaskar, what qualities do you think make an effective mentor in today's urology landscape?
I'd say empathy, accessibility, and integrity. A good mentor, and I completely agree, should listen, and they should listen more than they speak, and especially helping mentees find their own answers, because sometimes they need to discover it for themselves. And in today's fast-paced environment, being approachable and genuinely being invested in somebody's growth is what makes the biggest difference. And for me, once they join the team, they're family. And I would look after them and I'd advise them as I do for my family. So coming to you, you have been the diversity, equity, and inclusivity lead in the society. And looking ahead, how can you formalize or strengthen mentorship networks to ensure there's inclusivity in urology?
That's also a great question, Bhaskar. I think there's a lot of opportunities out there. I think formal mentorship programs help at all levels, really starting as early as college, but going all the way through as junior faculty. Young Endo has a really nice mentorship program with junior faculty and fellows. I think networking events at conferences also provide opportunities for connecting with colleagues. And I think there's sponsorship opportunities with funding to support these endeavors as well. Already existent mentor and mentee online platforms like UpSquad through the AUA that we have access to and should encourage more people to utilize. Do you think it's important for mentors to share their own failures as well as their successes? Could you share maybe an example where being open about failure helped a mentee?
Yeah, absolutely. I think sharing failure is absolutely critical. And in my personal life, I've learned more from my failures than successes. And that's probably true in all aspects of life, not just urology. So I often tell my trainees about papers or projects or grants that did not go as planned, despite putting a lot of time and effort, or procedures that taught me humility early in my career, because you learn from your mistakes and hopefully you don't want to make them again. When mentees see even senior surgeons face setbacks, I think it normalizes their struggle and helps build resilience because they can see they're not alone. One of my mentees had a major research paper project rejection, and I shared my own story of multiple rejections before getting some papers accepted. I think it completely reframed the mindset from disappointment to determination. And it was so good to see because then you feel, well, actually, it is also sometimes the wisdom that comes with the journey that can help the mentees. So, as mentors, how do you encourage your mentees during these challenging times, Joe, that we've all faced? For example, after a surgical complication, a research rejection, or even a career setback?
Yeah, I mean, I think this may seem like a tough question at first, but I think that the number one most important way to handle a challenging time is with a direct conversation while going back to that listening that we keep talking about and then providing reassurance. I think just like you mentioned, sharing your own disappointments. I also would offer to try to connect them with a colleague or peer if I haven't shared those similar experiences that have had similar experiences to see if that helps. And I always encourage them not to give up and to try again, because I think that's how we really got to where we are today.
Yeah. And now this is difficult for me, but I want to ask you, how do you strike the balance between supportive and giving constructive, but sometimes difficult feedback, which may not always be easy?
I think this can be difficult, as you mentioned, in any circumstance. So, what I try to do is build trust first so that they know that my goal is to help them grow and support their development. And then I try to provide feedback in the context of achieving their goals to evaluate what's working and then what they can improve upon. I try to invite conversation so that I can still use those listening skills that we keep talking about to hear them as well. In your experience, what role does celebrating even small successes play in keeping mentees motivated?
Oh, it's huge. I think recognizing progress, even small wins, builds the confidence and the momentum. I make it a point to highlight achievements, whether it's a good presentation, a well written paper draft, or handling a procedure or a case nicely in operating room or in the outpatient clinic. I think these moments remind mentees that growth is a journey made of many small steps. And it's how confidence is built over time. And on a personal note, I normally plan a summer and a pre-Christmas research party at my place with the team. Again, to foster team spirit, make them feel appreciated, and really celebrate each other's success, whether it's small or big.
That's great.
Yeah, so that I think for us, it works really well. We really feel connected. If you look at your journey, both as a mentor and mentee, Joe, through successes, failures, navigating cultural, gender differences, what is the single most important lesson you carry forward, guiding the next generation?
No, I think it's as simple as hard work pays off. I think you need to stay true to yourself and your values. And I think you need to make trusted friends along the way and open up to those you trust. And, maybe that's more than one thing, but I think truly they're all related.
Agreed.
So
Yeah.
I mean, for the young urologists listening today, Bhaskar, what's your one piece of advice on how to thrive in endourology while truly embracing diversity and supporting each other's successes?
I think my simple advice to young people would be open, be kind, and try and be good or excellent. These aspects, excellence will earn you respect, openness will help you to learn from everyone around you, and kindness will build the collaborations that sustain a fulfilling career, like we have, for example, Jo, with each other. Endourology is evolving, it's team driven, and success comes not just from technical skills, because that a lot of people have, but actually lifting others as you grow, building these networks and teams, and finally embracing diversity and sharing the opportunities, and remembering that best achievements are those that are made and celebrated together. Sure. Last question for you. If you could describe the future of endourology in a phrase or a word, what would it be and why?
Yeah, I think cutting edge is what comes to mind. One, because of the technology explosion that is making the field less invasive while also improving outcomes for patients, both from safety and efficiency perspective and from outcomes perspective.
Thank you. Jo, listen, thank you so much. This was a real insight into how a mentor, mentee, or the pathway, and I've learned some things about gender and diversity as well along the way. So thank you so much for this excellent podcast. I'm sure there'll be many more to come. And with that, I would like to thank the EAU and to Jo for joining us.
Thank you, Bhaskar, so much. And thank you to the EAU as well for thinking of me and this topic, which is so very important.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.